With so much medical information available today, it can be hard to find the right evidence to make decisions. Sometimes research results even contradict each other, which makes decision-making more difficult. This is why evidence-based approaches, like evidence-based medicine, evidence-based practice, and evidence-based research, are so important. The Pico framework is a simple tool used in evidence-based medicine and evidence-based practice to create clear research questions. It helps break down a question into small parts so it is easier to study. Pico stands for patient or population, intervention, comparison, and outcome. P is patient, population, or problem. How would you describe your group of patients? The P in Pico defines who or what the research is about. It describes the population or problem the study will focus on. A population can be defined using age, gender, health condition, disease severity, or specific characteristics. It can also include special groups like children, elderly, or pregnant women. Defining the problem means stating what condition, issue, or challenge is being studied. For example, adults aged 65 and older with type 2 diabetes and high blood pressure, pregnant women at 28 to 32 weeks gestation with high risk of preterm birth, children aged 6 to 12 with moderate persistent asthma, patients aged 18 to 50 with confirmed mild to moderate COVID-19 infection. A vague population like people with heart disease is too broad. Specificity like adults aged 50 to 70 with coronary artery disease makes research easier to plan, measure, and apply to real patients. This ensures that the study results are accurate and meaningful. I is intervention. What main intervention are you considering? The I represent the main action, treatment, or program being tested in the research. It is what the study wants to measure to see if it produces a benefit or change. Interventions can include medications, therapies, lifestyle programs, educational sessions, or procedures. The intervention must be clearly defined, including details like type, dosage, frequency, method, and duration so that it can be reproduced in practice or future studies. Examples: remdesivir administered intravenously at 200 mg on day 1, then 100 mg daily for 5 days in adults with COVID-19, low-dose aspirin, 75 mg daily, given to pregnant women from 12 to 36 weeks gestation to prevent preterm delivery. Structured aerobic exercise program, 30 minutes per day, 5 days per week for 12 weeks, for children with asthma, cognitive behavioral therapy sessions, 1 hour weekly for 8 weeks, for adults with insomnia. Intervention must be specific. Saying exercise is too general. But specifying type, time, frequency, and duration makes it measurable. This helps in evaluating the actual effect of the intervention and comparing results with other studies. C is comparison or control. What is the main alternative to compare with the intervention? The C is the group, method, or situation that the main intervention is compared against. It allows the researcher to see if the intervention works better than another option or no treatment at all. A comparison can be no intervention, standard treatment, alternative method, or other practices. Examples: remdesivir versus standard supportive care in hospitalized COVID-19 patients, low-dose aspirin versus no aspirin in preventing preterm birth among high-risk pregnant women, aerobic exercise program versus normal daily activity in children with asthma, cognitive behavioral therapy versus relaxation training in adults with insomnia. Comparison is important because it shows whether the intervention produces real benefits. For example, testing a drug without comparing it to a control does not prove if the drug actually improves outcomes. O is outcomes. What can you hope to accomplish, measure, improve, or affect? The O defines what the research wants to measure or achieve. Outcomes are the results or effects of the intervention. They should be specific, measurable, and relevant to the population and intervention. Outcomes can include improvements, prevention, reductions, or changes in health status. Examples: time to recovery and mortality reduction in adults with COVID-19 treated with remdesivir. Reduction in preterm births among pregnant women receiving low-dose aspirin. Improvement in peak expiratory flow rate and reduction of asthma attacks in children after aerobic exercise. Improved sleep quality and reduced insomnia episodes in adults after cognitive behavioral therapy. Outcomes are not the intervention itself. For example, giving aspirin is not the outcome. The outcome is whether it actually reduces preterm delivery rates. Well-defined outcomes ensure research results are clear, measurable, and applicable worldwide. How to create a Pico question. Find a clinical or research problem based on observation, existing knowledge gaps, or clinical challenges. You can use ChatGPT to help create a Pico question. For example, I asked ChatGPT to create a Pico question, and then I added my interest area, such as diabetes. In this case, the population and problem are adults with type 2 diabetes who have poor blood sugar control, HbA1c greater than 8%. The intervention is weekly telehealth self-management coaching, the comparison is routine clinic visits only, and the outcome is better blood sugar control within 3 months. Now, do not rely only on AI for this. The next step is to ask ChatGPT to give some recent Google Scholar articles related to this Pico question. After that, you can read these articles to learn more about the Pico question. This helps you find gaps and adjust your research question based on the latest evidence. You can also use the method I explained in the above video on how to use ChatGPT for research, where I showed how to read research papers using ChatGPT. You can paste the articles into ChatGPT and ask it to refine the Pico question. Please watch the above video to see these steps.